Your safety suddenly finds itself in the middle of a growing mental health crisis.
This is people self-medicating themselves.
With few public treatment options for Miami Valley families with a mentally ill loved one.
It's terrible. It's terrible.
Those living with mental illness are committing more crimes, meaning more jail beds instead of treatment facilities treating the mentally ill.
We have a lot of people in jail that don't need to be there.
The I-Team investigates the mental health crisis' public safety impact.
Our I-Team is finding hardly any public treatment options for people with a mental illness, and it is leading to a crisis level of number of people in the Montgomery County Jail, a problem that can sometimes start with violence on our public streets and compounded by some of our neighbors with a mental illness ending up in jail when they use illegal drugs hoping to treat their symptoms. The I-Team's Mike Campbell is on the front lines with those fighting this community crisis.
Mental health challenges started gripping Camilla Statton's son shortly after he graduated from a Dayton high school.
It's just one thing that led to another, you know.
2 years later, a trail of mugshots show the impact she feels that progressing mental illness has repeatedly had on his life.
To where he couldn't get a job, he couldn't hold a job. He was arguing with family members. He wasn't listening. He was misbehaving.
Eventually, his mom remembers his mental illness turning into a public safety threat. Dayton police say when he tried to rob his neighbor by breaking a flower pot over their head, his neighbor shot her son. 2 days after being hospitalized, he was taken to jail.
No, I didn't rob no one. Excuse me, ma'am, I'm talking to the judge. I didn't rob anyone. No one read me my rights, ma'am. They just took me away.
During his court hearing the next day, he seemed confused.
He's given us a lot of problems. He's on his way back upstairs right now.
As his criminal history shows, that is only the most recent time.
We have a lot of people in jail that don't need to be there, shouldn't be there, and need help elsewhere.
Dayton Municipal Court Judge Christopher Roberts told the I-Team he's seen an explosion of people accused of crimes, also showing mental illness signs.
Not only is it just mental health and crime, but it's also mental health, drug abuse, and crime. There's that dual diagnosis with drug abuse, which just exacerbates the problem even more.
This facility off Wayne Avenue was once a state mental health hospital, but closed years ago because of budget concerns, and that has left the state with only 1,100 beds publicly available for mental health treatment.
Some of those beds come from here, Cincinnati's Summit Behavioral Health Center. It's one of only 6 facilities still open across the state. All of Southwest Ohio is assigned here.
Summit Hospital may not have a bed available for anywhere from 2 to 3, 4 weeks.
We can tell you that a jail environment is not a place for somebody suffering from this illness.
Montgomery County Sheriff Rob Streck says he believes the community is facing a mental health crisis, one he thinks could leave the public at risk, including a recent Riverside standoff. The sheriff says hostage negotiators soon became concerned about 40-year-old suspect John Reese's mental health. He had assaulted his mother after she confronted him for using her credit card to buy guns and body armor. Reese would end up killing himself during the standoff. Investigators later found 128 items in the home, including guns, ammunition, and body armor.
And then people are going to be like, oh, here we go again. We had the opiate crisis, but what people have to realize is we kind of put the cart before the horse there.
Sheriff Streck says he frequently hears from Adamus board members who also professionally treat addicts. Their stories include patients taking opioids to self-medicate mental illness symptoms before ending up in jail. September numbers the I-Team reviewed show the Montgomery County Jail's population surging from just 2 years ago, an average of 750 to 900 inmates every day, about 1/3 receiving taxpayer-funded mental health treatment, including 99,000 tax dollars spent during the last 6 months on psychotropic drugs.
There are many sheriffs like me that are now, looking at redesigning facilities and things like that to help with some of this.
The sheriff now puts his worst mental health patients in these first-floor holding cells. They have a lot of glass. This is supposed to allow corrections officers to always be able to watch out for them. But it's not a solution.
Now we're trying to figure out how we can take people with mental health episodes to an actual treatment facility instead of the jail.
I really feel like an outsider looking in.
It is a situation Camilla Statton has found herself in. Getting private mental health care for her son, she says, proved difficult and expensive, and she feels trying to receive public help can be awkward.
You have to do steps after step after step in order for him to even get any help. So the first step is call the police.
Police stepping in can lead to patients receiving a 72-hour psychiatric hospital evaluation, but that does not necessarily lead to inpatient comprehensive mental health treatment. Today, Staton says she feels fortunate.
But he's in a good location to where there's doctors and they're helping him with housing.
Her son is finally in a mental health treatment program, living on his own and staying away from legal trouble. All she says she can do now is hope
your family. That's what it's about.
It stays that way. For the I-Team, Mike Campbell, News Center 7.
And for some perspective, you can see between July and September, the Regional Dispatch Center reported a nearly 90% increase in calls to help a mentally ill person. And there have been solutions suggested. Sheriff Streck supports legislation to create funding for a new non-jail-based evaluation and treatment center. In the meantime, the sheriff doubled his correction officers' training and inmates' counseling hours.